Dissection of the neck. Dissection of the neck structures should be dissected in situ and in a bloodless fluid. The block removal of the neck structures. As in routine autopsies may produce artifact in the neck tissue which resembles a bruise. When the tongue and neck structures are firmly grasped, pulled down, the hyoid bone may be fractured. Bruising invariably occurring in throttling also. It's very important in the absence of external mark or fracture of the neck structure. To obtain a bloodless field in the neck, the head should be opened and the brain, as in routine autopsy. The abdominal and the thoracic organs should be removed as in routine autopsy. The head is then moved slowly and up and down, allowed to drain of blood. Then an incision should be made from chin to the manubrium sternum, or a V-shaped incision made on the neck extending from the mastoid process on either side to the manubrium sternum, and the platysma is dissected. Platysma is dissected laterally. Platysma is dissected laterally on both sides. If the veins are damaged, they should be ligated to prevent bleeding. Otherwise, the blood will infiltrate into the tissues and may be mistaken for a contusion. Sternocleidomastoid and mastoid are cut from their attachment. Their common arteries. The common carotid arteries is longitudinally looking for any bruising around the bifurcation. Tear of the intima of the carotid. Carotid artery usually seen a half to 1 centimeter below the bifurcation of the vessels. Tooth forceps should not be used, as it may damage the intima, which resembles a tear. Hyoid bone is identified, and the suprahyoid and infrahyoid muscles are reflected. Noting for any contusion, sectioning of the thyrohyoid ligament, great corner of the hyoid bone, hyoid bone, and the superior corner of the thyroid cartilage permits manipulation of both structures independently for possible fractures. Hyoid bone is grasped at the body in one hand, and greater corner is tested with the other hand by bending it outwards in case and not the presence of the fracture. That is, by taking this presence of the hyoid bone, one hand and the greater corner is tested with the other hand. The presence of fracture. Fracture appears a regular break in the continuity of the bone is usually associated with the hemorrhage at the site of the fracture. And usually break in the continuity usually associated with hemorrhage at the site of the fracture. The thyroid cartilage is exposed by dissecting the thyroid gland through the isthmus and the middle constrictor muscles. Larynx and trachea are examined for the presence of any fracture. Usually injuries of the cervical vertebral column and the spinal cord are missed. The neck organ should be removed. An anterior longitudinal ligament of the vertebral column, is exposed and examined. Inside the posterior side of the neck and dissect down the spinous process, and also the ligaments attached to the foramen magnum and odontoid process is cut and expose the spinal canal. This is the dissection of neck.